Hi, I'm Dr. Mahesh. I'm the head of the critical care department in Aster MIMS Hospital, Calicut, Kerala. As you all know, we are going through a very tough time because of the pandemic of COVID-19, and a lot of healthcare workers are getting affected day by day because of this disease. Now, if you look at the statistics, the mortality rate in healthcare workers are pretty high when compared to the general public. And this probably is because we are exposed to the virus quite a lot. And also, we are dealing with a lot of procedures and processes where there's a lot of aerosol generation. So, especially in intensive care, we deal with a lot of COVID-19 patients, and also we do a lot of procedures which can actually generate a lot of aerosols, like intubations, suctioning, nasal swab or throat swab, swabbing the throat, using the non-invasive ventilation, so on and so forth. So, in our department, in our hospital, we have developed certain protocols which will help us to decrease the aerosol generation while we do the intubation and other procedures. So, let's talk about intubation today and see how we can decrease the aerosol generation and protect our staff and medical as well as nursing staff while we do these procedures to our patients. So, to help me with this video, I have got my consultant in intensive care, Dr. Qasim, and he will be taking you through the process, and we will see how we can help you with the these kind of procedures with low aerosol generation. Over to you, Dr. Qasim.
Thank you, Dr. Mahesh, for your kind introduction. Now, I will be demonstrating the what are all equipments that will be required for the intubation or in the COVID patients, that is the high risk aerosol generating procedures. This is the L board customized, made up of a plywood, and it is shaped in such a way that our both the hands will come into the midline, and that will be help in easy manipulating the airway while intubating the patient. And this part of the L board on which the patient's head will lie. Okay. So, this is the most important instrument which we will be using for intubation. This is a plastic clear transparent sheet which will be covered over the patient, and these are like routine our intubation instruments: laryngoscope, few towel clips, HME, intubation endotracheal tube. This is the tube tie which has to be lie beneath the neck before intubating the patient. And one more important thing that needs to be kept in mind is the HME filter that needs to be attached to the ET tube before intubating, and it should be kept ready. Okay. And last, our bag and mask.
Right. So, Dr. Qasim will show us how we can do this procedure safely. You have to make sure that any procedures which generates aerosols like intubation, CPR, an IV, all these things when you do, you have to be on full PPE. So, what we need is obviously a plastic sheet which is tucked in over the patient. We can actually pre-oxygenate the patient with 15 liters non-rebreather mask oxygen, and you can bag and mask the patient as well if required, because it is not going to push the aerosols into the room. And we've got a bed sheet which is tucked in over the plastic sheet so that it won't allow the plastic sheet to go up and then circulate the aerosols in the foot end of the patient. Then we have L board which is kept in the head end, and actually the patient is lying on the L board with his head on the L board. The plastic sheet is over the L board, tucked in, and even on the head end it is actually tucked in. We can use the towel clips or artery forceps to make sure that the plastic sheet doesn't flip over. We have kept the instruments for intubation inside the plastic sheet. So, we have got the laryngoscope on the left side of the patient's head. We have got a tube tie which is already kept underneath the patient's neck, and also we have got endotracheal tube attached to the HME filter and an ambu bag on the right side of the patient. So, to start with, we go through the head end, lifting up the plastic sheet in a way that it is not going above the chest of the intubator. So, the intubator is going to lean on the L board so that it is tucked in. If you really required, we can actually bag and mask the patient underneath the plastic sheet so that there won't be much of aerosol going into the room. Once you pre-oxygenate, go ahead with the intubation, and then as he goes in, then he can use the laryngoscope, and with that elbow you can see that he can actually, the hands are quite mobile. So, the left and the right hand can actually come to the midline. So he's using the laryngoscope to have a view. Because it's a clear plastic sheet, he can have a good view of the larynx, the vocal cords, and the endotracheal tube, which is attached to the HME filter, is actually introduced sideways. As you can see, it's not going through the midline. So once it goes into the mouth, it can be kept in the midline and then intubate easily. It's pretty easy to intubate with this kind of a maneuver, and because we have attached the HME filter into the endotracheal tube, aerosol generation soon after intubation can be prevented as well. And we can tie the endotracheal tube because the tube tie has already been placed there. So with one person we can just tie the endotracheal tube in position once the intubation is done and connect the ventilator. So in this way we can minimize the aerosol generation and aerosol circulating into the air and affecting the healthcare workers. So this helps to prevent the healthcare workers from being exposed to a lot of aerosols and decrease the chance of the healthcare workers getting COVID-19. All right.
Yeah.
To summarize, this is an easy technique by which we can do procedures like intubation and bronchoscopy, things like that, which can actually produce a lot of aerosols. We can do that very easily without generating aerosols or without pushing the aerosols out into the air, and that can be a very safe method. And it is cheap as well, so we can use that in any situation, especially in emergency department, in critical care, or even transferring patients out to the radiology or operation theater, so that we are not going to infect other people with the aerosols. So this just needs a plastic sheet, a clear plastic sheet, and an L board which can be customized, which can be made pretty easily in any institution. Thank you.